Hi everyone, this is Divya from Quick Mommy Hacks, and today we are going to talk about postpartum mental health. So, a lot of women in their postpartum phase suffer from a variety of mental health issues, ranging from baby blues or postpartum blues to postpartum depression and even postpartum psychosis. And to shed more light on these conditions, we have Dr. Madhura Samudra with us here today. Dr. Madhura, she's a psychiatrist and she's a mental health educator. She's also the founder of Sign Me Up. Hi, Madhura, how are you?
I'm good, thank you, Divya. How are you?
I'm good. So, thank you so much for joining us today to talk about postpartum mental health. So, let me
Thank
actually
you.
first start with my first question, which is about baby blues. So, what
Right.
are the signs of baby blues, and when does it emerge?
Right. So, baby blues, as we are talking about postpartum mental health, obviously occurs after delivery. The most common time for it to emerge is 3 to 5 days. And the signs that are usually seen are, a general mood instability, a depressed mood,
Hmm.
tearfulness that the mother cannot control crying spells and is having a lot many crying spells, and sort of a confused state of the mother where she's a little bit flimsy and clumsy, which is not to her pertaining to her normal character. So these are the most common signs you see in baby blues.
So, what percentage of women go through it?
It's actually quite common if you look at it. I mean, they say that the lowest range is 30%, but it can go up to 75% women who have a baby can have baby blues.
So, what exactly causes baby blues?
The basic theory is that the major hormonal changes that a mother is going through during pregnancy are one of the biggest reasons baby blues occur. But some other reasons could be, just the general stress of
Hmm.
delivery
Yeah.
and the awareness that she's becoming a new mother, and that she's having a new responsibility, the baby, that can cause baby blues also.
Okay. So, what exactly can you do to cope up with the postpartum blues or baby blues?
Right. So baby blues does not technically need any treatment or
Hmm.
intervention per se, just familial support, educating the mother that this is, a very common thing to happen and there's nothing to worry about, involving family and
Hmm.
her husband especially into the
Yeah.
process of taking care of the baby helps the mother a lot.
So, how
Right.
is postpartum depression different from baby blues? I mean, what are its signs and when does it emerge?
Right. So, postpartum depression actually emerges later than baby blues. Like I mentioned, baby blues occur in the first few days
Hmm.
after the delivery.
Yeah.
Postpartum depression can occur anytime up to 12 weeks after the
Okay.
delivery. And the symptoms are a little bit more severe. I mean, the patient is going to have, yes, sadness of mood and tearfulness, but she's also going to have sleep and appetite disturbances. She won't be able to sleep that much. She will lose a lot of weight because she's not eating. Also, it can have suicidal ideas, which is a
Okay.
very concerning sign for
Hmm.
postpartum depression.
Yeah.
And yeah, so that's how it is different from baby blues.
So, in your opinion, what percentage of women go through postpartum depression, and who are the people who are more susceptible to it?
Right. So, postpartum depression is not that common as baby blues, but still 10 to 15% of new mothers do go through postpartum depression. People at risk, I would say, are people with history of
Hmm.
depression in their earlier life, or
Yeah.
people with family history of mood disorders, be it
Hmm.
depression or a bipolar disorder. Those are more at risk. Also, with a concomitant substance use, like a
Hmm.
use of alcohol or smoking during pregnancy, can increase the risk of postpartum depression. And we say that if there is a history of baby blues, it can further lead to a depressive episode also.
So, what kind of treatment should you seek for postpartum depression?
Right. So, since it is a depressive episode, we usually start with antidepressants, but there comes a sort of a dilemma for a psychiatrist when you're starting antidepressants for a new mother,
Yeah.
because antidepressants do go in the breast milk.
Hmm.
So, it depends on the severity of the depressive episode.
Mm-hmm.
if there are suicidal ideas in the mother, or she is having major sleep disturbances or loss of weight, we will definitely choose to start her on antidepressants and take care of the breastfeeding otherwise. But if psychotherapy can help the
Mm-hmm.
mother, then we would choose that route first.
So, I
Yeah.
mean, how can you get your family and your partner involved, in the treatment?
So, just the basic support or physical presence of your partner during
Mm-hmm.
these visits to the psychiatrist is a big support for the woman. If she knows that the partner is not going to leave her, that reduces a lot of stress on the mother in itself. I mean, the major fear for the women going through this depressive episode is whether or not my husband is going to, be there for me when I come out of this.
Mm-hmm.
And if we educate them properly and tell them that, yes, this is a temporary episode and it can get better with
Mm-hmm.
proper treatment, that in itself is a major relief. And just educating them and being there for them is a good way to support.
So, I mean, if it's not treated properly, how long does it last usually?
It can go on for months to years if it's not treated properly, and it usually does not resolve on its own. It may end into a much more severe episode, or ultimately suicide if there are suicidal
Oh,
ideas. So we
okay.
have to
Mm-hmm.
be very careful.
So, can it have like everlasting effects on mom and the baby as well, if it's not treated properly? I know you mentioned
Right,
suicide, but otherwise,
right.
yeah.
Yeah, it can lead to. So, depressive episodes can be episodic. Uh,
Yeah.
if there is a general resolution of the episode after a few months, but there is a very, very high chance that it will recur, in the future.
Mm-hmm.
And the baby per se is not much at risk, other than the fact that the mother is going to be sick and not going to be
Yeah.
there to support him
Mm-hmm.
psychologically. So
Mm-hmm.
that in that way, yes, the child suffers as well.
So, in your practice in general, how many women do you see, who go through postpartum depression or baby blues, like, who come to you for help?
Right. So, baby blues per se, we don't see that much because
Okay.
mothers in general now are more aware of
Mm-hmm.
baby blues that happen. And since it is common, usually it gets resolved in a few days or weeks,
Mm-hmm.
and it is taken care of, on a household level. Postpartum depression, yes, we do see a lot of cases, and it's always easily manageable when they come early on,
Yeah.
when they are losing sleep, when they are not functioning well, when
Mm-hmm.
they are brought to us in that state, we can treat them more, easily, and we can maintain
Mm-hmm.
them in the future. Um, Not that if they come in the later stages, they are not going to be treated, but yes, it's a little bit more difficult at that stage because it has reached quite a latter stage, which we wouldn't want. But
Mm-hmm.
yes, definitely it is treatable, and we have seen immense improvement in patients.
So besides like the psychotherapy and the antidepressants that you mentioned, is there something else, which the moms can, do immediately after postpartum? Just, of course, like they're aware of baby blues and postpartum depression, but, just to maintain an active lifestyle or, do something
Right.
to help themselves. Yeah.
So, like I mentioned, one of the commonest reasons for baby blues or depression is the basic stress
Yeah.
of being a new mother.
Yeah.
So, what I would like to tell the mothers, or expecting mothers, is that if you are going to have a child, if you prepare yourself from the pregnancy, like
Mm-hmm.
during your pregnancy, if you are well prepared, if you're reading up on books or reading
Mm-hmm.
blogs, meeting your doctor, regularly for your appointments, taking classes, taking motherhood classes, it in itself kind of reduces the stress and the anxiety you're about to face when the baby arrives. And being prepared for a thing automatically reduces the stress, which
Mm-hmm.
can reduce the implications that you're going to have after the baby arrives. So that can be a very good thing that you can implement in your life. Another thing is that the hormonal changes that you're going through,
Mm-hmm.
those are going to happen either way. So when they do occur and when you feel a gush of emotions after the delivery, it's best not to freak out. It's best not to stress upon the fact
Mm-hmm.
that, what if I'm having baby blues? What if I'm having,
Yeah.
postpartum depression? Instead of going to that conclusion, there are, your obstetric people and your psychiatrists that are always going to help you. And it's always better to consult a professional during that time.
Do you think like having a motherhood community also helps?
Definitely, yes. Listening to other people's experiences, sharing your own experiences if you've had any, definitely helps and encourages people to, seek more help and be more aware of what's happening.
So we have also heard about postpartum psychosis. So can you describe like how postpartum psychosis is different from postpartum depression?
So a psychotic illness basically includes two components which are very important for its diagnosis. One is a delusion, that is a
Mm-hmm.
false belief that the person, possesses, and hallucinations, which are either unreal voices or unreal images, like you're seeing things that do not exist, you're hearing voices that are not around
Mm-hmm.
you. So, in case of a postpartum psychosis, it usually begins with a mood disorder, like what we see in depression.
Mm-hmm.
Patient is going to have mood instability, crying spells. She will be a little irritable, confused. Her sleep and appetite are going to be disturbed. But it soon progresses to an extent where she's delusional about the baby's health, as in
Okay.
there's something
Mm-hmm.
wrong with the baby. He's either sick or someone is trying to harm my baby, someone is trying to kill my baby. Or it, on the flip side, it could be that she does not even believe the existence of the baby. She would say that
Mm-hmm.
I never had a baby, I'm not married, I am actually a virgin. And we have seen that in multiple cases.
Okay.
And when the person is hallucinating, she is going to hear voices of people
Mm-hmm.
threatening her that we are
Mm-hmm.
going to harm your baby, or commanding voices, which can be actually quite dangerous for the mother's and
Mm-hmm.
baby's health, commanding her to do things, either
Okay.
hurt the
Mm-hmm.
baby, either hurt herself.
Mm-hmm.
And that's the highest risk which we see in postpartum psychosis, that the mother may eventually go up
Mm-hmm.
to harming her own baby or harming herself.
Oh wow. Mm-hmm.
And in those cases, we need to immediately intervene and admit the mother for the
Mm-hmm.
safety of her and the baby.
So how common is it, and which group of women are more susceptible to it?
Postpartum psychosis is not that common. We say it's seen in about 1 to 2 pregnancies per thousand pregnancies. That's like zero point
Okay.
0.1 to 0.2%.
Mm-hmm.
But the risk factors stay pretty much the same for mood disorders. Like if you have a
Mm-hmm.
family history of any psychotic illness, if you have a family history of depression, bipolar affective disorder, or if you have had a past history of depression
Mm-hmm.
or bipolar in your
Yeah.
life, yes, then you are susceptible. In following pregnancies and future pregnancies, if you have had a history of postpartum psychosis in the first pregnancy, then
Mm-hmm.
50% women do have a second episode during the second following pregnancy. So we
Okay.
have to warn them to watch for
Mm-hmm.
similar symptoms that occurred in the first pregnancy, and we
Mm-hmm.
just have to wait and watch and intervene, at the right time.
So how long does it last usually?
It begins usually by 8 weeks, like
Okay.
maximum by 8 weeks. And just like depression, if not intervened, it can last a long, long time. And it usually ends in not such a good way. So it's always best, especially in the case of postpartum psychosis, there has to be an intervention.
Okay.
Otherwise, it's really dangerous for the mother or the baby.
So, in your opinion, what is the usual kind of treatment for postpartum psychosis? Like, what do you recommend? Yeah.
It has to be a medical treatment in the beginning, especially
Mm-hmm.
because patient is not in touch with reality. And we usually start with antipsychotics, which are very safe drugs that are available nowadays. And we have given them in mothers who are breastfeeding, who are
Mm-hmm.
taking care of the baby, and it's completely safe. The other and more aggressive form of treatment we use sometimes when the mother is highly suicidal or infanticidal is electroconvulsive therapy,
Mhm.
which is we give a very short duration and amplitude of current to the mother. And that's a very, very safe technique
Mhm.
nowadays with the, advancement in technology and anesthesia. And basically why we choose that is it's the quickest acting
Mhm.
and the results are seen very quickly and efficiently, which we need in a mother's case because we need her to get back on her feet and go take care of
Yeah.
her baby immediately. So yeah,
Mhm.
that is one more route we do adapt.
In case of postpartum depression and postpartum psychosis, if the mom is, cured of it, or like she doesn't have the postpartum depression or psychosis anymore, is there a chance that these things could come back in a form of just, general depression or other kind, later on?
Yes, postpartum depression can, in a few cases, lead to a depressive illness in the future.
Mm-hmm.
And that's just the, biochemical mechanism in your brain that has kind of gone haywire once. But if you are well aware of the symptoms that are occurring, and
Yeah.
again, if it is intervened quickly and efficiently, then the episode is not going to be that severe. Postpartum psychosis may lead to a schizophrenia like illness in the future. I wouldn't be telling the truth if I said that it can be avoided in the future because it can't. I mean, we cannot give specific criteria that who is going to become psychotic or become depressed later on.
Mm-hmm.
But if you have suffered through it once, we just have to educate them well enough that they watch out for the symptoms in the future and they themselves come to the psychiatrists, well enough in time where we can treat
Mm-hmm.
them nicely. And even if they are diagnosed with a depressive episode or a psychotic episode in the future, if they are maintaining well on treatment, they
Yeah.
are bound to have a very, very normal life.
Mm-hmm.
And that's one of the greatest advantages of, the medicines that we are having right now, which are available right
Mm-hmm.
now, that the person can lead a completely new normal life. And I
Mm-hmm.
think there's nothing like it. If you could prevent an episode like that, we would definitely want to, but we can treat it and we can bring them back to normal, which is a
Mm-hmm.
great deal.
So, what kind of advice do you have for women who are going through either baby blues or postpartum depression or, postpartum psychosis, or who just want to be aware of, the kind of precautions they should take or the things they should be aware of?
So, like I have mentioned earlier, it's always better to be prepared.
Mm-hmm.
If you take up and use this time, and it's a beautiful time that you're having, you're pregnant and you're expecting a baby, but there is a lot of stress and anxiety, which is very natural to occur. So,
Mm-hmm.
if you utilize this time and prepare yourself for the welcoming of, the new guest, it's going to make you little less anxious.
Mm-hmm.
And I always tell them that adapt a less stressful and more peaceful environment at home, be it the work stress, be it your daily routine. A little change in your routine can also lead to a long way. If someone is used to waking up at 6 a.m., even waking up 1 hour later feels a little bit more relaxed.
Mm-hmm.
And if there's support from the family, it's definitely, a big, big load off their minds.
Yeah.
So, little bit changes having your husband involved throughout the
Mm-hmm.
pregnancy and in the delivery process, that also helps. And if you are suffering from any of the three conditions that we have talked about, I would suggest that there's nothing to, be frightened of, and it's not the end of the world. We can treat it, we can diagnose it,
Mm-hmm.
and definitely manage it at a very, very early level, and you can go back to being yourself within no time.
And do you have any words of advice for the partners or, for the family members in general?
So yeah, I would like to tell the husbands that just be there. I mean, I understand that it's going to be a big change for you as well. And there is a lot of frustration with the partners because they feel that there is added stress, maybe financial, maybe responsibility wise, and there's a lot of sexual tension as well because your wife is
Mhm.
going through a major change.
Yeah.
But just hang in there and kind of understand the, repercussions of what is going through her mind and her body.
Hmm.
And you being there, you just lending your hand once in a while, telling her how important and beautiful she is. That in itself does the trick sometimes. So yeah, be more well read, take part in her activities, be it a
Hmm.
Lamaze class, be it yoga, be it just watching a blog about motherhood or parenting in general, and be as involved as possible. And yeah, you'll be good to go.
Yeah, I guess like you gave us some really insightful information about all the three conditions that moms can, have in their postpartum stage. So thank you so much for joining us and for providing us with all the valuable information. Thank you, Madhura.
Thank you, Divya. Thank you.
Thank you. If you like our videos, do subscribe to our YouTube channel, Quick Mommy Hacks, and follow us on Instagram for some personal tips on pregnancy, childbirth, and motherhood. And do leave your feedback and comments. We would love to hear from you.